Saya sedang menunggu Dr. Edward. Dr. Edward dah ada ke belum? Dr. Edward? Okay, saya masih lagi menunggu Dr. Edward sebab katanya ada panggilan telefon yang urgent. So kita beri sedikit masa. Okay. Selamat datang kepada yang baru menyertai webinar. Selamat datang. Okay. So tajuk webinar kita pada hari ini adalah Ketidakserasian Seksual Antara Pasangan, Cabaran dan Peluang. Okay. Saya masih menunggu Dr. Edward.
Ya, thank you Fiza. Saya rasa doktor ada gangguan teknikal kan seperti biasa. Lagipun sini hujan lebat. Saya rasa kita kena tunggu sebentar. Ada 5 minit supaya doktor boleh tukar dia punya device dan sambung semula.
Okey.
Okay. Apakah pendapat Fiza tentang tajuk ini?
Okay, for me lah, I selalu berjumpa dengan couple yang datang actually because of different problem. Kan datang mungkin sebab especially masalah kesuburan, because saya bertugas di Jabatan Obstetrik dan Gynecology. So dia akan datang cakap mungkin dah setahun berkahwin, tak ada anak, okay. Dan bila kita bertanya, rupanya the main problem is not ada problem kesuburan. The main problem is ada masalah seksual. So sometimes masalah seksual tu maybe because in Malaysia we don't have a proper sexual education sebelum berkahwin. Jadi bila tak ada ilmu yang betul, they don't know kan. Even some of them tak tahu yang cara bersama untuk mengandung tu macam mana. So ada banyak masalah yang kita discover. Tapi jarang untuk pesakit tu sendiri datang dan jumpa kata the first complaint is saya ada masalah seksual. That is very rare to be found, especially in our community yang ada banyak stigma. But it is a very important problem. Sometimes they come because of other things. Contohnya, boleh tak saya nak buat urutan untuk kuatkan bahagian vagina. And then bila kita further test, rupanya there's other problem kan, ada masalah lain. So I think this is a very important topic to be discovered because memang banyak masalah sebenarnya, especially untuk orang yang selepas bersalin to dapatkan balik dia punya sexual activity after dah deliver, especially after anak pertama. So it is a problem, but tak banyak orang yang tahu dan tak banyak orang wants to address the problem. So it's a very interesting and important topic to be discussed.
Betul. Saya rasa cerita pasal topik doktor pun sudah bersertai dengan kita.
Doktor dah ada, okey.
Ya. Selamat datang doktor.
Selamat tengah hari.
Okey Dr. Edward. Apa khabar?
Khabar baik.
Okey. Jadi
Afisa.
Okey.
You punya preferred name ke? Okey.
Okey. Jadi saya mulakanlah dengan soalan yang pertama. Okey.
Yes, silakan.
Apakah ketidakserasian seksual yang paling biasa, the most common, yang paling biasa dihadapi oleh pasangan?
Okay, yeah. Sexual problem kita boleh bilang ialah incompatibility, ya. Satu pihak mau lain punya sexual ataupun lebih banyak atau lebih satu pihak mau lebih jarang, tidak sama punya aktiviti, tidak sama punya type sexual activity. Ini ialah yang memang yang English kita panggil incompatible sexual need. So incompatible, ya. Yang tidak sama punya lah, dia punya keperluan. Walaupun yang ada yang lebih banyak, lebih tinggi, ataupun dia punya dia punya the expression tidak sama lah, you know. Some dia kebanyakan pihak perempuan dia perlu lebih banyak foreplay dulu, lelaki lebih kurang. Itu ya setengah ialah oleh kerana gender difference lah, you know, sexual expression dia punya different.
Okay. So
Yeah.
biasanya berlaku tidak serasi itu lelaki atau perempuan, ataupun memang you see both ada problem tidak serasi?
Both memang ada macam Uma dan saya sekarang kita ada satu couple. Yang lelaki dia tidak berasa dia punya nafsu memang lebih kurang dari dia punya girlfriend, you know, sampai dia punya girlfriend complain, dia girlfriend cadangkan jumpa kita lah, right? Mula-mula jumpa kita dan Uma ataupun Taya ada di sini kan, ini Taya punya klien. Lepas itu kepada Uma, mula-mula dia sudah beberapa bulan pun tak ada seks. Sekarang sudah selepas jumpa kita 3-4 kali, sekarang sudah ada tapi belum sampai normal lah. Jadi dari research kita dapat tahu kalau pasangan ada sexual activity 1 kali 1 minggu, ini memang optimum punya sexual health lah, yang kasih yang paling bagus punya happiness untuk pasangan. Jadi ada banyak couple dia 1 tahun mungkin ada 1-2 kali saja ini ada problem lah.
So bagaimana ketidakserasian ni? How does this incompatibility boleh menjejaskan hubungan?
Okay, ini kerana ini incompatibility, dia akan results supaya pasangan yang ada keperluan yang lebih banyak itu mungkin mereka berasa macam dia tamak begini, ya. Macam mereka berasa mereka tidak ada sensitif dengan pihak yang lain itu, ya. Itu ialah satu masalah. Dalam and at the same time pasangan yang lain yang ada keperluan yang lebih kurang itu mungkin dia berasa defektif, ya. Dia ada berasa dia tidak bagus, dia tidak boleh memuaskan, dia tidak pandai, atau tidak boleh, atau tidak sanggup memberi keperluan pasangan yang lain itu. Jadi ini ada especially kalau kedua-dua perasaan ini mereka tidak communicate kan, akan ada menjadi satu fantasi lah, ya, yang kedua-dua pun mereka akan membuat mind reading dan fikir kebanyakan lah, supaya ini menjadi satu blockage, you know, mengikatkan.
Daripada pengalaman Dr. Edward,
ya, pengalaman saya apa itu?
From your experience lah, kalau yes, pengalaman, ada ke couple yang at the verge of divorce, maksudnya dah ada problem, they will say ada masalah lain, but actually when you discover actually a sexual problem.
Yes, of course, a lot, and then unfortunately ada kebanyakan ini pasangan itu oleh kerana itu mereka ada affair lah, right? Kerana dia tidak dapat mendapatkan keperluan, itu dia jadi senang vulnerable untuk affair ini, emotional ataupun sexual affair. Dan itu akan juga mengakibatkan divorce.
Penceraian. Yes.
Pencerayan, yes.
Okay. So, soalan seterusnya, bagaimanakah pasangan boleh menggunakan this incompatibility, ketidakserasian seksual sebagai peluang untuk mengembangkan dan mendalami hubungan mereka?
Okay, ya. Jadi incompatibility ini boleh menjadi satu peluang supaya kedua-dua pihak boleh mengambil peluang ini untuk berbincang keperluan mereka. Dalam satu situasi yang selamat, ya. Jadi mereka boleh mengeluarkan apa yang mereka perlu dan tengok bagaimana pihak yang lain dia punya perspektif, apa perasaan mereka kalau tidak dapat keperluan itu. Jadi ini menjadi satu peluang untuk mengedalamkan lagi pengenalan sama satu dengan lain, masing-masing. Yeah.
So kalau let's say we have satu pasangan yang memang they are aware, dia memang tahu dia ada incompatibility dari segi keperluan seksual. Jadi from our side, apakah strategi yang boleh digunakan untuk pasangan ni? What we can do, or what themselves can do to mengenang
Right. So first of all, kalau mereka jumpa sex therapist, kita ada service ini sebagai couple therapist, sex therapist, kita pun ada kursus sex therapy punya kurs. Jadi kita first of all kita need to explore apakah causes, apakah kesebabkan dalam mengakibatkan ini yang misalnya kekurangan nafsu untuk seks, ada sexual abuse dari dulu, ini memang common punya, ataupun ada apa-apa exposure yang sexual activity adalah satu negatif punya pengalaman. Mungkin dia semasa kecil tengah kebanyakan perbincangan yang negatif untuk seks, ataupun dari segi culture, segi the religion pun. Jadi kita kena tahu dari mana. Memang kita ada assessment for the sexual attitude test, ya. Ini satu questionnaire yang pihak boleh complete untuk tahu dia punya attitude dengan seks, ya. Jadi memang kemudian ada skema kan yang kita ini psychological program yang kita panggil skema itu. Mungkin ada skema emotional inhibition, skema the vulnerability to harm, ini banyak skema yang akan menyebabkan the expression of sex yang telah di curtail. Okay, so this is the first thing we need to buat assessment untuk tahu apakah sebab dari segi selain dari psychological causes, ada juga physical causes, macam hormon, testosteron, hormon bukan penting untuk lelaki tapi untuk perempuan juga, memberikan sexual drive. Ada lagi hormon yang lain seperti DHEA. Ini semua kita boleh mengajikan untuk ambil saliva saja.
Okay.
Ya,
So
dan satu
let's
lagi
say
ialah
this couple comes and dia berjumpa dengan sex therapist, diberikan
yes.
pengenalan tentang their scheme of sexual attitude, and also dia buat hormone test. Adakah rawatan ni berkesan untuk pasangan tu?
Yeah, which is why kita tengok apakah sebab itu ialah dari segi hormon atau segi neurotransmitter pun ada, macam dopamin dia kurang, jadi dia kebolehan untuk mengambil pleasure, enjoyment pun sudah kurang. Ini pun ada. Jadi kita kena buat assessment supaya kita tahu punca yang ke sexual problem ini dari segi fisikal, ada segi psikologikal, ada kedua-dua pun ada. Right? Kalau dalam segi fisikal memang senang saja kita boleh memberikan, kasih treatment tanpa natural punya hormon, neurotransmitter punya precursor kita boleh menaikkan. Tapi dalam psychological itu ambil masa lebih sedikit, Kalau dalam cultural punya experience, ini memang mau ambil lebih banyak masa.
Lebih banyak masa. Okay.
Yes.
Soalan seterusnya, what are the challenges? Apakah cabaran dalam mengatasi incompatibility dalam seksual? Apa cabaran?
Well, I mean, one of the challenges ialah mengenai attitude lah, right? To get a attitude, especially when you have a cultural, their budaya punya perbezaan, religion punya perbezaan, right? Tadi ini memang sensitif dan ada banyak challenges, right? So the like for example, our attitude towards masturbation. Not sure how you call that in Malay, yeah. But ini memang tidak sama punya budaya, dia pandangan tidak sama lah, right? Yeah. So that become.
I mean, stigma daripada masyarakat. Let's say memang the couple acknowledge that they have this problem, and then bila nak pergi berjumpa dengan sex therapist, akan ada stigma, especially in Malay couples or orang yang beragama Islam, kenapa nak jumpa dengan sex therapist, or kenapa nak reveal your problem dalam kain lah, orang cakap kan. So adakah stigma is one of the challenges for couples as well?
I think so, but of course, as psychologists, we will have a confidentiality lah, PNC for all the treatment, but a couple need to get the courage, but of course, like in a Muslim society, right? If you see your ustad, dia punya nasihat memang different from. So that is why we have a lot of Muslim couple coming to see us, because they know they memang tidak dapat the therapy, or that's of course they can get the therapy according to their religion, tapi not according maybe to what they need. So
do you encounter macam orang ni dah jumpa ustaz, then usually ustaz akan cakap, okay, the woman, perempuan mesti obey, like if the
exactly yes.
But there will be problem when it's not incompatible and the woman feels
exactly yes, and then the husband one sex all the time, a few times a day, then the woman have to obey, then become a problem. Right?
Okay,
so,
I think that's a big challenge like in our community. Itulah satu cabaran besar. So we
Yes.
want bagi satu kesedaran supaya there is a change in how they think. Sebab actually in relationship, even though daripada segi agama Islam, you have to be passionate. Maksudnya kena ada rasa, bertimbang rasa kepada pasangan. So kena they understand, and then if memang ada masalah, they have to get the appropriate treatment. Mesti dapat rawatan yang sepatutnya, rather than merelakan diri untuk terpaksa. Sepatutnya it's not supposed to be something forceful lah. Okay.
Right.
Soalan
Makes
seterusnya, what are the importance of communication? Apakah kepentingan berkomunikasi dalam menangani ketidakserasian seksual?
What is the communication problem? Is it?
Yes.
Well, like I said, couple mereka tidak mengeluarkan perasaan mereka lah, right? So they have resentment, they bury, right? They feel the other party they tidak cooperative, not consider their need. So these are all.
Let's see the couple, one of the person in satu couple. So contohnya suami ada problem tidak serasi dengan wife, tapi wife yang needs to see the therapist for counselling. Maksudnya husband tak nak jumpa, only the wife nak jumpa. Then do you actually suggest for only one of the couple, ataupun memang every therapy kena ada dua-dua? But what about if memang husband tak nak pergi but the wife really needs, do you still give the treatment and counselling?
Yes, because the couple is like a system, right? Macam satu system, like the thing you put on top of the baby cot, right? It's all interconnected. You know, the little star you put on top of the baby cot. If you take one out, the whole thing become imbalanced, right? So with the couple, even though satu saja yang datang, you know, isteri saja yang datang, kalau dia boleh tukar dia punya behavior, dia punya attitude, ini akan pasangan memang dia punya relationship ada effect, you know, husband pun can change, right? So it's okay, we can just what we want, but of course kalau kedua-dua datang, ini memang best punya, you know, option lah.
Okay.
But we can
What
work
about
with it.
Let's say couple therapy, tapi maybe for women lah, dia ada rasa malu untuk cerita dengan counselor yang different sex. Means that counselor lelaki, you are sitting,
which is why in International Psychology Center kita ada you know, both sex punya counselor, punya sex therapist, you know, especially sex therapists, you know, we need you know, preferably same sex, you know, woman to woman, not Muslim to Muslim. So we need to provide compatible background. Yeah, best lah kalau boleh. You know, but not, of course, not all our counselor have all the disorder experience. Bukan semesti counselor ada sexual dalam mengalami sexual disorder sendiri sebelum dia boleh kasih treatment kan. So we can also be versatile, you know. Kalau walaupun kita lain pun punya agenda, kita pun ada experience boleh kasih terapi untuk patient yang
usually therapy is done sama-sama together or is separate?
Yes, we would normally recommend at least one session individual dari setiap party. Selepas itu baru kedua-dua, you know, couple session. So one session individual.
Sama-sama dan berasingan.
Yeah, in case dia ada apa yang dia tidak boleh kongsi, you know, semasa dalam joint session kan, kita kasih peluang dia mengeluarkan dulu,
Okay.
dalam tapi kita memang recommend semua kongsi sajalah, kita ada satu transparent punya sistem lebih bagus.
Okay. So, bilakah pasangan harus mendapatkan bantuan profesional? When is the cut-off point? Bila kita nak dapat? Because sometimes couples not aware that they are having this
Okay,
problem.
so we have in fact an instrument called Prepare and Reach, right? Dia ada dua bahagian. Prepare ini untuk couple sebelum mereka berkahwin, preparing for marriage. Jadi ini ada lebih dari 100 question dalam beberapa section seperti parenting section, friend section, the social activity section, habits. Semua ini kita look at the percentage of agreement. Sama ada mereka bersetuju atau tidak, ini parenting style kita mau, atau kita expression of affection, even sex, semua ini memang ada kebanyakan ini isu couple tidak berbincang sebelum berkahwin. Jadi ini adalah merupakan satu opportunity dalam result kita. Sebenarnya ada banyak perbezaan kamu punya attitude dengan parenting. Ini satu dan juga dalam segi seks pun ada. Ini kamu tidak suka oral sex, tapi husband kamu, boyfriend kamu nak. Jadi ini merupakan satu peluang untuk discussion, alright? Jadi dan satu part lagi ialah enrich. Enrich ini untuk pasangan yang sudah kahwin. Ini macam satu relationship health test. Boleh buat 1 tahun 1 kali sebab kita boleh nampak dalam result apa section yang mereka masih ada disagreement. Jadi ini merupakan satu peluang lagi untuk discussion. Mungkin financial management. Jadi dalam segi seks ada kebanyakan problem kenapa mereka do not have good sex ini oleh kerana dalam lain aspek punya relationship mereka ada disagreement. Jadi ini boleh menjadikan satu opportunity untuk memberikan counseling supaya disagreement ini boleh diayankan. So this is one way couple can see, Tapi kalau lagi satu ialah tengok bagaimana mereka pasangan feel dengan mereka punya sex life. Okay. Adakah kedua-dua pihak punya keperluan bukan 100% dapatkan, tapi bagaimana mereka feel ada puas hati atau tidak, right? What more they can improve, and then I think it's good to have a chat once in a while, with a sex therapist to just sit down. Maybe some of this conversation on your own mungkin suka untuk berbincang, kan? Kalau ada satu facilitator kita boleh facilitate.
Okay, so these two things, which is premarital counseling, lebih kurang belum berkahwin, and also pasangan yang dah berkahwin. So how does a couple get this kind of counseling? Is it online? Because for me myself, I never encounter this premarital counseling questionnaire. Untuk yang
I can. Uma, are you there? Can you share on the chat box the prepare and enrich? All right, the prepare and enrich link. Maybe I think we also mentioned the IPC website, the prepare and enrich, send the link there. Yes, maybe if you even can get a sample report showing the percentage of positive agreement, you can share that. Yeah, this is very, very important because this is a research done by Dr. David Olson. He's a clinical psychologist based in the US. And ini instrumen ada digunakan kebanyakan dalam itu apa ini church, right? In churches that they use before marriage, and then they also found so the result will categorize you into 5 categories of couple. From vitalized, very good couple, to traditional, conflicted, harmonious, or what we call devitalized, very low energy, devitalized. And they look at the risk of divorce. Kalau devitalized memang kurang dari 1 tahun, their chance of divorce is very high, compared to the vitalized one. So all this is already out in the research from this paper enriched instrument. So you can use it as a predictor of divorce, of risk of divorce. Yes, but on the other hand, you can use it to change, right, the results. Kalau kamu merupakan satu devitalized couple, kita boleh meninggikan, change you punya type to a more vitalized type of couple. So this is possible. So the Oma, if you can find that 5 type of results in the prepare, enrich, and show from devitalized to vitalized, that'll be good to show what we mean. Okay. Yes. So that's a good news. Things can change, right? And the other very
done before married or sebelum kahwin?
Kedua-dua pun, kalau kamu belum kahwin, tetapi sudah ada pasangan yang stable, right? Best to then do it sebelum kahwin. So that if there are a lot of disagreement identify, kita bukan we are not saying don't get married, tapi ini merupakan satu peluang untuk berbincang, mendapatkan counseling untuk negotiate, to navigate the perbezaan ini sebelum dia selepas berkahwin menjadi satu problem, merupakan satu problem akan meletup dalam your relationship, kan? So better to do that. And even for those who are married, then you can do it to review kamu punya relationship, right? From time to time, to use it as a way to get better communication, know each other better. Yes.
Okay. So my last question is, International Psychology Center, what kind of perkhidmatan, what kind of service yang ada untuk counselling or untuk sebelum kahwin, selepas kahwin? I think you mentioned some of it. How does you conduct the perkhidmatan, melalui online ataupun face to face?
Right. Yes. So since COVID, a lot of our session like this webinar, we can do it online. In sex therapy, it is easily done online, of course, right? So online is possible, but of course we are open physically as well. Kalau pasangan, not come physically is possible. Because of the online option, sometimes couple are from even different country, different location, we can still do it, online with couple in different places. So that is one of the advantage. So the uniqueness of International Psychology Center is we, from the sex therapy point of view, kita ada physical punya treatment and assessment, as well as the psychology punya assessment and then treatment, and we can combine. So physical yang we say hormone, neurotransmitters, and then psychology we can do not only the prepare and reach, which is attitude, but also personality. Personality we haven't talk about, but it also merupakan satu punca juga untuk problem untuk seksual. Misalnya ada kita ada pasangan yang dia I don't know whether you're familiar with MBTI, Myers-Briggs Types Indicator kan, ada satu personality ialah feeling, emotional. Lebih banyak female, mempunyai personality ini personality, emosi, more feeling type, they make decision based on feeling. Tapi kebanyakan lelaki dia more logical, more thinking. Jadi ini merupakan satu konflik, right? So for the female, they want to have the feel, to feel needed, to feel appreciated, to feel in the mood for sex. Tapi for men, less of this need of romance, and so for them it's more logical. We need it once a week or twice a week. Time. Put it in the calendar, and so untuk counseling kita nak stretch, yang kita lemah punya personality untuk pasangan kita. So we use each other as teacher of the weakness in our personality. Jadi ada kebanyakan kategori of personality yang opposite. Ini memang akan merupakan satu problem untuk seks juga. Right.
Okay. From your experience,
Yes.
berapa umur couple yang seek for your advice? Yang paling tua, I mean 50s, ada 60s.
Oh, even 70s. We have 70s. Yeah. No reason why the couple cannot enjoy sex even to the to the old age, right? Especially with the physical help, with hormonal the treatment. So the idea of hormonal treatment using bioidentical hormone, ini hormone yang natural punya. So we measure first, what is your level, and if it is lower, lower not compared to your age, but compared to your healthy adult, madam, 25-year-old or so, what is the optimum level, and then we can make it back to that optimum level, right? So hormone is not just for sex, although it is related to sexual performance, sexual drive. For women is related to the thickness of the organ, the lubrication, of the organ. So all these will contribute to the sexual experience, right? So it is related to the health, to gut hormone, yang female punya sex hormone, estrogen, progesterone, all these we measure as well and replace as necessary, right? So that is the what IPC combine the physical and the psychological, right?
So in IPC means that kalau pesakit ataupun klien ada problem dengan hormon, you can give the treatment as well. You can give.
Yes. We work very closely with Well Lab, which is our sister lab that do all the measurement and all the compounding supplements. So IPC, of course, we have a psychiatric department as well that can prescribe medication. Although that might not always be needed dalam segi. For example, some of the sexual problem is vaginismus, right? So this is when during intercourse you have pain. So that can be physical, can be psychological punya punca, right? So psychological memang due to past negative experience, rape or abuse, right? Or this fear, then the during so there's a fear, right? During the sexual intercourse. And then the fear will cause the tightness, the dryness and all that, or that could be and also a hormonal neurotransmitter cause as well. So can be
basically vaginismus ada punca daripada psikoterapi, and psychotherapy alone can treat the condition.
Yes, especially if it is mainly psychological. Yeah, due to past trauma, then we can use a lot of psychotherapy, couple therapy to treat for sure. Yeah. So we need to do the assessment first to see which one they are from, right? So yeah, but so whatever the source we can use it, but a lot of the cases is a combination. Even though it's physical, there could be some psychological causes as well, right? So yeah. Yes.
Do IPC work closely dengan other doctors or other hospitals to give the physical problem treatment? Like
yes,
so you need a professional help in terms of that. So do you guys work together with other discipline as well?
Well, we do provide well lab, we do provide the test to many doctors, for the neurotransmitters test. This is the chemical in the brain. So, for example, low dopamine we mentioned, low serotonin will cause low sexual drive, right? So that could be low libido, that could be due to that. So we do provide these to many doctors and then hospitals to do this. Yes.
Okay. Terima kasih kepada Edward atas perkongsian hari ini. So I'm opening the question to the floor. If sesiapa ada soalan, boleh unmute mic, tanya soalan directly ataupun type di ruang chat untuk saya ajukan soalan kepada Dr. Edward. Any question from anyone?
I can see Farah there. Farah, you already expecting, your child, I believe. So how's your sexual activity? Yeah, he's going to leave now. It's going to avoiding the question.
Hi, hello, doctor.
I'm going to ask you, how's your sex life now since you are pregnant? Is it happening or not happening?
Hello. Okay. Good day to all. Thank you, doctor. All right. Yeah, it is my first experience, my first pregnancy. So somehow,
how is sex life? Yes.
Yeah. Somehow I'm not really, how to say, experience the thing. So yeah, it seems like the first experience. I think even in my pregnancy condition, the sexual relationship still ongoing, even though not frequent. I mean once in a week, 2 or 3 times, I think.
Oh, very good, excellent. So of course you're using a very safe position for sex.
Yeah, but have to be careful since like in a pregnant. I mean now 8 months and plus. So yeah.
Good to hear that. Yeah. I think because when you're pregnant, your sexual hormone is on the peak. Then you have a lot of sexual desire and sexual drive. You are sexually very positioned, or your sex hormone are on the peak. So I think it's a good time for sexual activity.
Exactly. I think this depends on individual, doctor, and everyone, because it depends on the spouse, on ourselves, on our spouse. we have to communicate what we want actually in the intercourse relationship. If you keep silent, you're just following your partner to do this and that, and then you feel unsatisfied lah.
Right. Yeah. So you need to know what you want as well. Right. Okay. Yes. Thank you for your sharing.
All right, you're welcome.
Okay,
No
thank
worries.
you, Farah, for your sharing. Okay, so yes, I can see to you that good sex means good life, good married life, and you have to have good sex to have a good married life. That is very important. Okay, any more question from the floor, or anyone wants to share anything? Any more question?
I have one question, Dr. Hafiza, is it?
Yes.
Okay. I'm wondering, I don't know the situation, but there is a person or male or female, man or woman, before they got married, they do, we call it onani.
Masturbation. Okay.
Yes. How they feel that, and then after they got married, how does that thing? I mean, I
Goes
cannot
away.
imagine that, but I'm wondering.
Okay. I think I passed the question to Dr. Edward. How does masturbation, I think, affect?
So you're asking from the perspective of the male or female, the Farah?
I think from
Perspective.
male.
I think both. Yeah,
from
generally. Yeah, because I don't
Generally.
know. I'm just wondering.
Well, generally, I don't think it would change for the male. In fact, this has become a problem for many, especially a Muslim couple. For we have couple whereby the wife suddenly discover that the husband masturbates, right? After some time, right? Sebelum ini dia memang tidak tahu, dia fikir dia satu, So this is the problem. Like I mentioned before, the way the culture really just look at masturbation as if it is like a sin, which I think it is true in Muslim religion is considered to be a sin, right? And I think if that there is a way to neutralize the sin, you have to do some washing and read some Quran, right? But the problem is that the wife attitude of the husband changed. They realize that the husband. Well, and of course, depends on how you masturbate, right? But when the wife see that the husband was using pornography to masturbate, then they become more of a problem, right? Because then did you then this is like maybe can be thought of as the the husband was having desire on other women. So yes, it can lead to a lot of problem, and so this is one of the common problems we find. Hidden masturbation, not openly discussed, before they get into marriage, and then one party finds it unacceptable. That can be a problem. But the problem on the other hand, I think it's also a problem in the sense that the female do not we find that very often, not only in the Muslim culture, but even in like the Chinese community, Indian community, that the women don't seem to have a masturbation practice, right? So that is a problem as from the sexology point of view, because then the woman don't take the sexual responsibility, of their own sexuality, right? So then it becomes an opportunity during sex therapy to educate the woman that how masturbation is beneficial and can be practiced. I mean, we have to have put it within a way that is consistent with their religion, right? But for most religion, it's not a problem. And it can even be an activity to be shared with the couple. So that is our take on masturbation, right? There's a lot of inequality in masturbation, because like when you see your son, the boys masturbate, you don't you don't criticize them as much. When you see the girl masturbating, then it becomes a big problem, right? So the way we look at masturbation between boys and girls is also very different. So which leads to this different attitude, right?
Okay,
So,
anyone have any more question? Okay, I think I have a question. Okay, Doctor, what I mentioned tentang pornography. So I think this is also another problem, but how does pornography affects the sexual desire between couples? Means that maybe the guy is addicted to pornography and then he got married, and then does it affect the sexual desire to the couple? Sebab dia dah ketahuan pornography, then he got married, does it gonna affect his sexual desire towards the couple, towards the wife?
Yeah, in a number of ways, right? Of course, I think this is another difference between man and woman sexuality. A man, once he has ejaculated, first of all, there's a distinction between between ejaculation and orgasm. Right? So there's a difference. So it is possible to have an orgasm without ejaculating. In fact, this is one of the highest sexual practice that has been for many hundreds of years, right? That have mastered it. So that's why the men are able to have multiple orgasms just like the woman, because they don't ejaculate. They choose to ejaculate only on the right moment, right? But the problem with masturbation is that the man would then ejaculate, right? So if they ejaculated, so depending on the age of the man, as they get older, like then when you're young, you probably can ejaculate a few times, but you still need time to recover. When you're younger, maybe you can recover in 20 minutes, right? But as you get older, you need a full hour and maybe a full day. So if you masturbate and ejaculated already, in the daytime, you're not going to be having the desire to have sex with your wife, right? After that, so you would. So unless you learn to masturbate without ejaculating, which we also teach our clients to do, right? So that are techniques on how to do that, so that you can. So this is also a nice way to control premature ejaculation, which is another common problem with men, right? So that they can then lengthen their sexual intercourse time. So the other problem with masturbation, especially using pornography, is that your dopamine level become different, right? Because you already stimulated with all the woman in the pornography, and then you see your wife, which is when you compare with that, it doesn't give you that same dopamine high, right? So that becomes a problem. So it is like you eat the same food, and then you go to a new place, a new food, obviously that there is a different spike hit on your dopamine. So that is become one of the challenges of using pornography in masturbation, So those are the challenges.
Okay. So
Yeah.
jika pasangan to discover that ada masalah dengan ketagihan pornografi, do you provide the
The
therapy for
treatment,
rehabilitation treatment? You do have
yeah,
the
we do, yes. That is a very common addiction. Yeah, but at the end of the day, we need to abstain and rewire. So it's possible to rewire the brain. You would take like 1 month abstaining from pornography, and of course, we have a step-by-step guide on how to do that. Using some supplement to replace the dopamine, use other way to increase because it's all about dopamine pornography. We have the addiction because we want to push up our dopamine level. So we find other ways to do that, and even you using the couple to help. Yes, that would be the way. But at the end of the day, it is possible to rewire the brain.
Okay, that is very good. Itu sangat bagus sebab I think sangat banyak orang ada this problem but they tahu nak pergi mana, they don't know how to reach. Maybe they will Google how to find a solution. This is a good option untuk dapatkan rawatan yang sepatutnya, berjumpa dengan psikoterapis untuk dapatkan rawatan untuk berikan penyelesaian kepada masalah itu supaya kita dapat hidup dengan harmoni dan bahagia instead of hidup dalam keterpaksaan, especially kepada woman, even lelaki juga, untuk kedua-duanya. Okay, so tengok tak ada lagi apa-apa soalan daripada peserta. No more question. Okay, terima kasih banyak-banyak Dr. Edward Chan atas penjelasan dan semua perkongsian yang diberikan pada hari ini. Jadi saya akhiri perbincangan kita pada hari ini. Do you have any last word, Dr. Edward? Ada kata-kata akhir?
Yes, so I want to close by I'm not sure how to say in Malay, but making the difference between pleasure and happiness. Right? So that there are a lot of sexual activity that give you pleasure. Pornography, for example, give you pleasure, but it doesn't give you happiness.
Understand?
Right? Pleasure can become satu ketagihan, right? But happiness, you might not. It's more than a feeling, right? It might not be pleasurable at the moment. You do something. You do some activity and investment. You put the effort in there, but the commitment will bring reward in the long run. It become happiness, right? So that is important to know. So this should be our goal: happiness, not just pleasure.
Understand? That is very good sharing from you. Okay, thank you so much. Terima kasih banyak-banyak Dr. Edward. Jadi di sini saja perbincangan kita dan perkongsian kita pada hari ini. Sangat menarik dan sangat informatif. Jadi saya sebagai moderator pada hari ini, Dr. Hafizah, mengucapkan terima kasih dan jumpa lagi next time di webinar seterusnya. Okay. Bye Dr. Edward. Bye everyone.
Terima kasih. Jumpa lagi. Bye.
Bye.